Today's topic, dyslexia. Dyslexia is a learning disorder that involves difficulty reading due to problems identifying speech sounds and learning how they relate to letters and words, decoding. Also called reading disability, dyslexia affects areas of the brain that process language. People with dyslexia have normal intelligence and usually have normal vision. Most children with dyslexia can succeed in school with tutoring or a specialized education program. Emotional support also plays an important role. Though there's no cure for dyslexia, early assessment and intervention result in the best outcome. Sometimes dyslexia goes undiagnosed for years and isn't recognized until adulthood, but it's never too late to seek help. Symptoms. Signs of dyslexia can be difficult to recognize before your child enters school, but some early clues may indicate a problem. Once your child reaches school age, your child's teacher may be the first to notice a problem. Severity varies, but the condition often becomes apparent as a child starts learning to read. Before school. Signs that a young child may be at risk of dyslexia include late talking, learning new words slowly, problems forming words correctly, such as reversing sounds in words or confusing words that sound alike. Problems remembering or naming letters, numbers, and colors. Difficulty learning nursery rhymes or playing rhyming games. School age. Once your child is in school, dyslexia signs and symptoms may become more apparent, including reading well below the expected level for age. Problems processing and understanding what he or she hears. Difficulty finding the right word or forming answers to questions. Problems remembering the sequence of things. Difficulty seeing, and occasionally hearing, similarities and differences in letters and words. Inability to sound out the pronunciation of an unfamiliar word. Difficulty spelling. Spending an unusually long time completing tasks that involve reading or writing. Avoiding activities that involve reading. Causes. Dyslexia tends to run in families. It appears to be linked to certain genes that affect how the brain processes reading and language, as well as risk factors in the environment. Risk factors. Dyslexia risk factors include a family history of dyslexia or other learning disabilities, premature birth or low birth weight, exposure during pregnancy to nicotine, drugs, alcohol, or infection that may alter brain development in the fetus. Individual differences in the parts of the brain that enable reading.